Good afternoon. Thank you for tuning in today to our webinar, looking at new feature sneak peeks. This is a big one. Message templates are coming to SecureMail very soon, and let's learn all about them. So with me today is Mark Ayre, our Director of Customer Operations. I am Jeff McKay, the Director of Marketing. We're going to take you through what are message templates. We'll talk about some of the ways they can be used, although it's fairly limitless. We'll look at appointment reminders, proactive patient engagement, preventive medicine, that kind of stuff, care plan management. There's a whole lot of changes coming to your SecureMail account and how you can use it and the different features and functions. This is a pretty strong foundation for what's coming in the next few months. We're going to spend most of our time doing a demonstration. That'll be Mark doing that. Sorry, Mark, I didn't let you say hi.
Hi, everyone.
Right there. There he is.
Yep.
And then we'll talk about, some additional resources. Of course, you can always take additional SecureMail training. If you haven't taken it yet, it's in your SecureMail account. In the learning management system, you can just click on training once you log into Brightsquid and take the training. And the clinics that have taken that training do find it super helpful in terms of the implementation of SecureMail in their clinic. And we see once clinics do take the training, they tend to increase their usage by about 65% because they see more applications and different ways they can use it. So we'll talk to that. But what are message templates? So it's a place where you can create and store standard common messages, things you always send out to patients, so you don't have to retype those all the time. You can send them to multiple recipients at once. So you'll be able to do is you can enter different email addresses or recipients in the to field, and you'll also be able to import a list. So if you had a panel of patients that you wanted to talk to, say you're diabetics or males over 40 that you wanted to get back in for a physical, you'll be able to import a list of those contacts and send them a templated SecureMail message all at once. So it's pretty exciting stuff. They'll be customizable, so you'll be able to say, hey, I want the patient name to go in here and I want our clinic name to go in here, that kind of stuff. You'll be able to include attachments and templates so that you can, send, if you have people you want to get in for a physical, or you wanted to do some sampling, some surveying in your patients, you could attach that and send it to everybody all at once. And there's no limit to what you can do. So this is coming soon. We do have some clinics in the beta test right now, and we'll talk at the end about how you can get involved in that if you'd like to try it out. So, and Mark, chime in here because you've been working with clinics to go through this, but appointment reminders and personalization. So, let's say you want to send a reminder to all of your patients who are coming in next week for a physical, or you want to send a reminder to all your patients who have an appointment in 2 days. You'll be able to import that list, send them a message, hey, this is a reminder about your appointment at our clinic. Here's some information you need to know about our COVID-19 procedures, or here's a form we'd like you to fill out and get back to us before you come in. It's going to save a ton of time. It's going to eliminate a lot of phone calls, and also, of course, boost or eliminate or reduce, I guess, your no-show rate for sure. And then we can do personalized stuff based on, like I said, name, physician, condition. So like we said, if you wanted to look at everybody who's coming in for a specific issue, if it's categorized that way, then you can send them information about that. Like we said, or like I said, you can create as many templates as need be. And Mark, I know we've had a ton of volume going through this service already, and people are really using it. Does this align with what's being done?
Yeah, absolutely. I mean, I've been working with clinics, probably a bunch of people that are on the call today, for a number of years. And the one thing that I've heard time and time again is, we often find ourselves sending the same messages. We have, 4 or 5 set messages we send to our patients. We have another, half a dozen that we send to our professional colleagues. We just want to be able to reuse that content, save ourselves the trouble of retyping it every time. And so this I think very much fills a need that hopefully everyone on the phone call is going to find a lot of use for. We could come up with tons of examples here, Jeff, but I think everyone's going to have their own ideas right away. I'm going to show a couple of samples and we'll go from there.
Great. This is another great scenario, especially now during COVID-19. The reports that we get back from clinics is that patients aren't doing the regular care and checkups that they should be. People are delaying care. It's a really good way to re-engage people, get them back into the clinic. Reach out about mental health issues. Hey, if you have any questions or feelings about this, please fill out this form, and keeping track of your patients. How are they feeling? How are they doing? We don't want them to be delaying care because that only makes matters worse. So, in terms of getting people, not even necessarily in the clinic, but engaged with the clinic, we know that that's going to improve overall health outcomes of the population. So, like we said, we can prompt patients to book appointments. Hey, we haven't seen you. You're due for a physical. Most clinics have you know men like Mark and I that don't go to the doctor as regularly as we should in our age bracket. Um, and it's just a good way to remind a whole lot of people once without having to spend clinic time, staff time calling everybody and saying, hey, it's really time for you to come back in. This is a way that we can proactively get people back in. Filter for appointments that can be handled virtually. So if you're scheduling physician time, a lot of clinics, I know my clinic where I go is they're about 50-50. They're on the phone, or they're seeing people in person. So you can look at things differently in that regard, and look for ways to focus, appointments on some of the virtual billing codes like 0301S for secure mail messages. Let your patients know that they can reach out to you through this way, and anything that's appropriate can be addressed through secure mail, and that's a billable event. Preventative medicine templates. So send out screening questionnaires. If you've got a population that you want to reach out to, or some conditions that are near and dear to a physician in terms of their expertise or what they want to focus on, or some of their goals or your clinic goals, or what's prevalent in your community. You can reach out, send screening questionnaires, get people re-engaged. They might not realize what they're feeling is an issue. So this really helps get things addressed promptly, or at all that might slip through the cracks otherwise. That does improve patient outcomes. Like we said, re-engage dormant patients, people that have been brought into the clinic as a patient. They're connected, but they haven't been in for a while. It might be time to bring them back in, like I said, for physical or something else. That improves continuity of care. When I do things like look up keyword searches on Google, I think last month there was 7,000 people that searched for online doctor visit in Alberta. So patients are looking for remote access. They're looking for virtual care options and if they don't find it at their clinic, they're looking for other ways. And like through our insurance that we use at Brightsquid, we have our provider does offer virtual care, and Mark and I, exchange emails that we get from that service, trying to prompt us to get care outside of our regular medical home. It's not something that we're going to do because we understand the benefits of that, but lots of patients are taking advantage of those options when they're not available at their clinic. So these templates help you engage all of your clinic or way more of your patients through secure mail to help them stay connected and attached to your clinic. And in that sense, because this is something that patients look for, this is something that patients really appreciate. We literally have hundreds of quotes from patients saying, "Thank you for secure mail. Thank you for using this. Secure mail has been a godsend through COVID and beyond." And lots of different ways that patients use it that fits into patient lives around things like, I don't have to drive half an hour or 2 hours to get to my clinic. I don't have to hire a babysitter for my kid while I go to the doctor because I don't want to bring them into the waiting room or into the clinic. So lots of different ways that this can be employed. And in terms of care plan management, what that will look like, and we won't get to that today because we don't have the demonstration, but imagine the ability to create a series of messages that you can send out to patients. Let's say, a newly expected mother, and here's um, when I was expecting my 3 kids all at once. we got regular messages from the government. I was living actually in Washington State at the time, and they sent out regular messages saying, "Here's what to expect this month, and here's what to expect this month," and that continued quarterly after the kids were born, even. So things like that, just to help boost patient awareness and treatment adherence, that sort of thing, really will help. So with that, I think we want to get to the meat of the presentation today. Mark, if you want to grab control there, I'll let you get into the demonstration.
Yep, sure thing. I'll turn on the screen broadcast on my side now, and then momentarily everyone will see what's happening and then get started on the demonstration. Let's see here. Oh, did I share the right screen? I did not. There's what I wanted to share. All right, everyone should be seeing my screen now. This is, those of you obviously are already familiar with Brightsquid Secure Mail, so I'm not going to touch too much on the basics today. I really want to focus my time on this this template feature that allows us to reuse the same message content and some of the placeholders to personalize messages when we send them out to our patients or professional colleagues. So to begin with, once this feature is widely available, you'll have a new tab in your settings page, which is templates. And within this tab is where you're able to create new message templates from scratch and or edit or add on to existing templates you may have already created. Now, hopefully when we launch this for you, we'll put a couple of sample templates in here to get you started. But I'm sure those of you that are, sitting with your colleagues right now are already scratching down on your post-it notes all the templates that you'd like to create. So I don't probably have to give you a whole lot of information around that. But let me show you an example as to how this works. So obviously, one thing that's top of mind, especially lately, is the current pandemic facing everyone. That's why they call it a global pandemic. So I'm going to create a new message template that I want to send out to all of my patients before they come into my practice. This is something that I'm hearing from clinics all the time is, they're sending this stuff out to their patients ahead of time before they come in to make sure they're properly screened, they're wearing a mask and all those things that we expect of one another in these difficult times. So I'm going to create a new message template. I'll select this big blue button here. And then I have already decided I'm going to call it my COVID, 19 awareness. Now this is just an internal name. This name is not visible to anyone other than to me and my staff. And then the subject line of the message. So we'll just call this COVID screening. And this will be the subject line of the message that the recipient will get in their secure mail inbox. And I'm just going to say, dear patient name. So we'll select actually recipient name. So I can select this placeholder here. So then when I compose the message to one or to multiple clinic people that are coming into my clinic tomorrow, it'll just fill in their name automatically. So I don't have to type in Adam and Bob and Charlie and whoever else. So we'll put in that recipient name. And then I'm just going to copy and paste from my existing COVID-19 screening form and saves me the trouble of having to make you watch me type it. So here's all the information that I want people to be aware of before they come in for the screening next or for their appointment. And then at the bottom of it, I'm just going to sign it regards, my own name. I'll use another placeholder, which is going to be sender name. And that's it. I've created my template. So we'll save that. And now, if I return to my list of templates, we can see that we have our half a dozen templates here. So I've got one here for surgical results that I might send back to a GP after I've seen their patient and I've done surgery on them. Pre-appointment questionnaires, these are top of mind for everyone I talk to these days. This is the idea that we can ask a patient a series of questions before they come in for their appointment, so we can better focus that precious time where they're actually in our clinic or connected over a Zoom call for that matter. So let's go now to the composition page. So this is something you're probably all very familiar with. So I go back to my inbox and I compose a new message. And this is the new feature down here. This is where you find the templates that we created earlier in the settings page. So here's that same list that we saw in the editing page. And I'm just going to quickly whip up a message. So I'm going to first address it to my patient Adam. And for what it's worth, I'm also going to address it to Fred. Both Fred and Adam are coming into my practice tomorrow. And you'll notice that when I address it to a second patient, this little red error message appears down here. This is indicating, of course, or reminding the sender that the patients won't see one another. Um, as you know, with traditional email, if I send a message to both Jeff and Cassidy, they would see one another on the subject line, or not the subject line, the address line. Secure mail, for privacy reasons, obviously doesn't work that way. So when I send a message to multiple patients, this little error message or warning message is just reminding me that we're not going to display Fred's information to Adams per se. And so now I can select the template. So they're both coming in tomorrow. I want them to be aware of our COVID-19 protocols. So I've slapped that in there, and now you can see that I've got this message. It says, dear recipient name, prior to you visiting us on date. Let's put in tomorrow's date. Now I do have to do this part manually right now. Probably that'll be updated here shortly. So tomorrow is the 26th of 2020, and the rest is done. So I don't need to type anything else. It's going to automatically fill in my name here in this salutation at the bottom, so I can just click send. Now in this example, I only addressed it to 2 patients. There's really no limit to the number of patients I could potentially address it to. So if I have 20 patients coming in tomorrow, I can just compose one message and send it to all 20 of them at the same time. Now, let me show you another example. I'm going to go back to my compose page, and I'm going to compose a new message. We'll use Adam as my example here again. And for his appointment tomorrow, I need to see some pictures because he's coming in to discuss a rash with Dr. Fauchard. So I'm going to select this pre-appointment questionnaire. And you can see here that this pre-appointment questionnaire, again, I'll put in the date. Oops, pardon my typos here. November 26, 2020. I'm going to send him a list of questions here that I'd like him to answer. Is your rash itchy? Is it bleeding? Is it changed shape? You know, the mind boggles at the number of questions we could potentially be asking our patients before they come in. But this will be helpful to focus the conversation. And I'm also going to request that he sends me a photo or two of his area of concern, whether it's a rash or a wound or what have you. So we'll send that off now. Now, for those of you that have used Secure Mail on a mobile device, you are probably aware that when you're responding to a Secure Mail message through a mobile device, you can use that mobile device's camera to take photos. So whether it's an iPhone or an Android phone or a tablet, when you're replying to a message, you can actually snap a photo, and it can be of a document, it can be of a rash or a lesion in this example, and then I can attach that message and send it back to to the desired recipient. So I prepared this ahead of time. So if I go back to my shared inbox and we look at this message that Clara and Fred exchanged earlier today, here's an example as to what the reply looks like when it comes back into the clinic. So I'll scroll down a little bit here and I'll zoom in a little to make this more legible for those of you on smaller devices. And so you can see here that the message that went out to Clara, or went from Clara to Fred a few minutes ago. I didn't put in the date, obviously, but he's now responded. So in the answer to my questions, is your rash itchy? Yes. Is it bleeding? Sometimes, et cetera, et cetera, and so on. And perhaps most importantly, he's attached these 2 photographs of his area of concern. Full disclosure, this is my thumb in, in its full high resolution glory. I just snapped this sitting here at my desk about an hour ago. So this is the kind of information that the patients can send back into the clinic, which, as I said already, is going to save so much time and make the actual in-person or Zoom call visit that much more efficient because we have the answers already. So as the clinic MOA, I can now take all this information, save it to a PDF document, or take these photos and put them directly into Fred's patient record in the EMR, so that prior to Dr. Fauchard walking into the clinic tomorrow to sit down and have a chat with Fred, he's able to review all this information, get a head start, and not have to repeat or ask these questions over again. Rather, he can ask more focusing questions about the concern that may exist on this patient's thumb in this example here. Jeff, any thoughts on these examples so far? If you're still with
No,
me, I
Mark.
caught you off guard, didn't I?
Yeah, I was like, wow, where's that mute button? No, not at all. But I will point out that we do have a question panel on the side. So if anybody has any questions about this process, about what templates means, how it works, certainly pop them in the question section there, and we will get the questions once we're through this.
Right. And that reminds me of another thing. You mentioned this in your presentation a minute ago, Jeff, but we have recently, it's been in here for a couple of months, but we've recently built in a training component into Brightsquid Secure Mail that allows all of our users to access built-in training as to how to use all these different secure mail features. So if you're new to the system, if you've just been invited by your clinic MOA or by your doctor, and it's your first time in the application, there's a couple of things I would recommend. First off, over here on the left side is this training we talked about. Now, depending on your subscription, you will have one or more training courses available to you. Those of you that have our privacy services bundle will have access to our online privacy training about privacy in your particular jurisdiction, be that Alberta, Ontario, Saskatchewan, or what have you. But everyone has access to the secure mail course. Now, this is the demonstration environment, so I think this is all dummy text. But in the live environment, you'll have access to about a half a dozen different course modules on how to use Brightsquid Secure Mail, how to get answers to your questions, how to invite patients, and all that great stuff that we want to do with the service. That tied in with access to our help and support portal over here in the top right hand corner, this little help icon, which may be hidden by your GoToWebinar panel, by the way, but trust me, it's there. There's a little question mark icon, and if you select that option, it'll take you to our help and support portal where you can find video tutorials and answers to questions, and perhaps most importantly, access to our support team. We're based in Calgary. We're available 8 to 5, Monday to Friday, and we make it very easy to get in touch with us. You can find our phone number, our email address, and our live chat options, all of which are available right here. But getting back to our templates conversation, there is no limit to the number of templates that you can create. As Jeff mentioned, we did release this feature to a small number of beta testers about 2 weeks ago. And so far, we've had about 60 or 70 different templates built and designed and created in the system, and we're seeing hundreds of messages going out through secure mail. So we're going to see record messages sent through secure mail once this is more widely released. Now, there's a lot more coming. I'm not sure how much I'm allowed to say here, Jeff, but I know that we're building in the ability to send to perhaps dozens or even hundreds of messages simultaneously to a list of patients, for example. We're also going to be making a little bit more complicated workflows, so maybe there's a follow-up message as well. This is the first step into this new area, so I'm really excited about where this is all going. Jeff, do we
Yeah,
have a question on the docket?
we do, and I was going to get to them after we finish demo, but while we're in here, so one question said, and this is a great one. If you send a message to hundreds of patients at once, and
Mhm.
we see that when patients respond, typically what they say is thank you. So if we send
Right.
100 messages or 500 messages out to patients, how are replies directed? Can you just show, because what I'm thinking is, there's a way to turn off notifications. There's a way to direct messages through your shared inbox. Can we just look at that real quickly, just so people can get a sense of how that works?
Yeah, certainly. I mean, that's a great question and something that I might not have considered. But to your question, when patients reply to secure mail messages, um, in most of your clinics, and if it isn't set up this way, please contact support and we'll help you get it configured properly. Patient messages should be routed to the shared inbox. What we try to avoid is having messages come back to a specific user's inbox who may be on vacation that week. So for example, if Clara sent a message to Adam or Fred yesterday and then goes off on vacation and the messages are addressed to her inbox, no one's going to deal with those in a timely fashion. So we really want to make sure that messages get routed to the shared inbox so they can be handled by a member of the team, not necessarily Clara or Jimmy or Dave or whoever else happen to have sent that message in the first place. It really is meant to be a team effort when it comes to managing secure mail messages. Now, to your other point about configuring or routing messages, that happens in the settings windows. So first off, when I go to my settings window, I will first see my personal details. So these are the details for Clara Barton, and she's who I'm currently logged in as. And down here towards the bottom of our settings window, there's a couple of different checkboxes that Jeff was referring to. And the first two are the ability to turn off certain messages going into my personal private inbox. So this is what I was talking about a moment ago, where currently we have turned off the ability for patients to message you. And by you, that means, well, me, Clara Barton in this example. So patients cannot send a message to my private inbox. If they attempt to do so, it'll automatically be routed to the shared inbox, which is the default setting, especially for physicians and other providers, because they want their messages being handled by their staff who are monitoring that shared inbox like we talked about. I can also turn off, and this is relatively new as well, I can also turn off my email notifications. By default, it's turned on so that every time a secure mail message is routed or sent to me, whether it's to my private inbox or to my shared inbox, I get an email notification at my regular old-fashioned email address. Now, we have a lot of our users that are getting dozens or hundreds of secure mail messages a day, so they don't need to be notified through a separate system. So you can turn these notifications off to reduce the clutter in your regular email address. Now, the opposite of that is for people that don't use secure mail every day, all day, it's important that these be turned on so that you're aware of incoming messages from your patients or professional colleagues. Lastly, over here in clinic details, now Clara doesn't have the ability to change these settings, pardon me, because she doesn't have administrative access to this clinic organization. However, you can see here there's the ability to turn off the clinic's shared mailbox. This is something that we have put in place, kind of, um, shall I say, in place of out of office notifications. So rather than allowing patients to message my clinic and then 10 or 15 minutes later sending them a note that says we're closed for the holidays, we allow your clinic to turn off the ability for patients to message you completely. So we actually will show them the warning ahead of time. So it's far more proactive than your traditional out of office notifications that regular email does. And this will actually prevent or block the patient from sending a message in the first place so that you're not dealing with a whole bunch of messages after the fact. Now, we will display your phone number to the clinic, or sorry, to the patient, so they can call your regular phone number, and then of course get whatever instructions you would want them to have. Call 911 if it's an emergency, or call your provincial health organization to get assistance if it's something that they can help with. But this is how you can actually better manage incoming messages in place of the out of office notifications that we're kind of used to with regular email. Looking at the clock on the wall, Jeff, we're
Okay.
running out of time. Is there anything else?
Yeah, I'm just going to take back control here, and because I think the rest of the questions can be covered in other ways. So we've been through this. Take your secure mail training. It's accessible here. The modules Mark talked about are, I mean, 3 to 6 minutes long each. I think there's only a few of them, and then you'll get a nice little certificate at the end saying that you're an expert in sending secure messages within healthcare environment. The most important part of today's presentation maybe is the winners of the draw. So we'll be sending out a $25 gift card to these 3 people. Most secure mail messages sent by a clinic in the last 30 days. The winner of that is Kim. So Kim, congratulations for doing that. And the winner of sending the most secure mail invites, so getting more patients on the system to communicate with, connecting with other clinics and providers, that is Salima. So congratulations to that. And for attending today, for participation, Lana wins $25 gift card. So thanks for that. We talked about the beta testing. So if anybody would like to get on that list and get into templates early and try it out, you can email Mark. There's his email address right there. It's pretty simple. And we have a couple other questions. One is any additional cost for this feature? So right now, no. There's adding this functionality to your account once it's fully available. This is just a feature of Secure Mail. So it's just an easier way for you to communicate en masse with your patients and sort of have a better reach. And the other question that we have still is Mark, we talked about communicating with patients a lot. Can professionals be included on these messages too?
Yeah, absolutely. I think I alluded that very, very briefly and should have highlighted it a bit more. But yes, absolutely. When you are composing a message and you're using a template, you can address that to whichever recipient is most appropriate. So some of the clinics do have, or oh, goodness gracious, I'm tripping over my tongue today. Some of our beta testing clinics have already created templates that they use to communicate with their collaborators, professional colleagues, and so on. So the short answer should have been yes, absolutely.
Awesome. Well, that concludes our webinar for today. We will be sending out the recording. That was one other question we had. So stay tuned for that, and have a great rest of your week, everybody. Thanks, Mark.
Thanks, everybody. Have a great afternoon.